Education Series, Module 3, Nutrition, Part 1. Dr. Brecky again. This project is in part created by Ready, Set, Smile. Thank you for joining us on this adventure. Module 3, Nutrition, Parts 1 and 2 is not a comprehensive training course, but it's an overall review, an educational tool designed to focus on the interface of nutrition and oral health. Additional resources will be cited throughout this module, and further reading on the topics is recommended. This material is subject to copyright by Dr. Brecky and Ready, Set, Smile. So, nutrition and oral health, Part 1 and 2. We'll review the importance of nutrition, basic concepts of nutrition, the intersection of oral health and nutrition, the sugar epidemic, barriers to adequate nutrition for people, and population-based nutritional considerations. We'll also talk about some translation of nutritional advice and accessing available resources. The oral cavity is the very first part of the digestive tract. Thus, nutrition and oral health have an important bidirectional relationship. As we've mentioned, poor oral health leads to reduced nutrition, yet poor nutrition also leads to reduced oral health. So let's review the basics. The USDA provides nutrition recommendations which have shifted from what you may have known as the food pyramid to My Plate. My Plate recommendations, they focus on a diet rich in vegetables, fruits, whole grains, and lean proteins. They recommend seeking foods low in sugars, saturated fats, and salts, and ensuring adequate, but not excessive, nutrient intake. Remember, it's important to be cognizant of nutritional labels and overall food intake. And as you can see below, this is the My Plate recommendation. So My Plate focuses greatly on vegetables, healthy oils, even, as you can see below, staying active. So if you just want to take a moment to review this diagram, it's shifted quite a bit from what the food pyramid used to recommend. As you can see, there is nowhere where we recommend sweets or any candies or any sort of, unhealthy component of our diet. Lastly, water. Tap water is one of the biggest things, recommending water, tea, and coffee with little or no sugar, limiting milk and dairy, limiting juice, and avoiding sugary drinks. So what are some key concepts of nutrition? We'll talk about macronutrients, which are the energy-filled components of our food: carbohydrates, fats, and proteins. Micronutrients are also essential. They're vitamins, minerals, trace elements, and antioxidants that we require in our diet to stay healthy. A calorie is a measurement of energy. That's how we use to measure how much energy a certain food is giving us. Technically, for you chemists, it's the amount of energy needed to raise 1 gram of water 1 degree Celsius. Lastly, metabolism. It's the chemical processes that occur within our bodies to convert foods and drinks into our energy in order to maintain life. Remember, nutrients which are required as a part of the human diet in order to sustain life are called essential nutrients. So what are these essential nutrients? Well, they're nutrients that the body cannot create. They must be obtained through the consumption of a well-rounded diet. They provide energy that helps to repair tissues. These include water, protein, carbohydrates, fats, vitamins, minerals, and fiber. Deficiencies in any of these essential nutrients create very negative consequences, many of which are actually visible, where? In the oral cavity. So let's understand calories. The amount of calories in 1 gram of each macronutrient. Proteins have 4, carbohydrates have 4, fats have 9, and not listed here, but alcohol has 7. What does this mean? For the same amount of each food that you're getting much, much more energy for fats of this, small amount versus proteins. So it's easy to rack up the calories if you're talking about fats or even alcohol. The recommended intake is a decent amount of carbohydrates. You can see 45% generally, whereas fats and proteins are recommended to be a smaller component of our diet. Like we talked about, well-rounded. That is the key to having adequate nutrition that fulfills the recommendations. So what's all this buzz about carbs? And why are they so bad? The good, the bad, and the ugly. First, real carbs, such as whole grains rich in nutrients and fibers, are good for you. So sometimes avoiding carbs may not be the best recommendation for you. However, secondly, refined carbs, stripped of their nutrients, they really aren't good for you. They are bad. So, avoiding bad refined carbs is certainly good nutritional advice. To count or not to count carbohydrates. What are carbs? I mean, pretzels, cookies, pastas, potatoes, fruits, breads, milk, corn, candy. How do you separate it all? Carbohydrates break down into simple sugars in the mouth, which then become the substrate for bacteria to feed on and create acids and create tooth decay or dental caries. This is something we've talked about before. Remember? Sugars. So what is the deal with carbs? Sugars are carbohydrates. And sugars cause tooth decay, right? Well, let's take a breakdown on these sugars. They now constitute 20% of our diets in the US. But humans have only recently started consuming this as a staple food, only about 300 years. Refined sugar is completely stripped of all fiber, of all nutrients. It is just a sweet, what we call empty calorie or carbohydrate, because you're really not getting any bang for your buck or any benefit for your nutritional choice. Interestingly, in the 50s and 60s, the medical community actually supported sugar's consumption, and it was recommended by doctors. We've seen this trend before with, I think, something called tobacco. So an interesting quote to think about: sugar is the food nobody needs, yet everybody craves. The sugar epidemic. It's been said that sugar can be as addictive as drugs like cocaine, and this addiction has been described actually as a global epidemic. The average American adult consumes 17 teaspoons of sugar in a day. Doesn't that sound kind of gross? This adds up to 57 pounds per year of sugar on average for each American adult. The American Heart recommendation only recommends max of 9 teaspoons a day per men and 6 for women. It's recommended that less than 10% of our caloric intake comes from sugar. But it just doesn't appear to be that way for most Americans. So always read your labels, look at serving size, and look at sugar content. Make sure that you're not accidentally sneaking sugars into your diet. What are some synonyms for sugar? There's glucose, corn syrup, high fructose corn syrup, honey, molasses, corn sweetener, fruit juice concentrates, malt syrup, malt sugar, fructose, glucose, sucrose, galactose, dextrose, lactose, maltose. There are a lot of sugars. Sometimes it can be very difficult to remember when you're looking at labels, but looking at these terms and knowing what to look for on those labels is really, really important in making sure that you're having a well-rounded diet, low in sugars. So what does sugar do to your brain and body? I love this diagram that was actually posted in Business Insider with information from some of the top journals of medicine in the US. But sugar affects everything. Look, it affects your insulin resistance. It leads to diabetes. It affects your memory, your regulation of blood sugar, high blood pressure, heart disease, weight gain, cavities, fatty liver disease, pancreatic cancer, and just generally how we feel. So reducing sugar from your diet can be a difficult thing at first, but a lot of people cite that they feel a lot better once they really cut it out and start choosing alternative, healthful foods. Too much sugar intake may lead to malnutrition. Did you say too much and malnutrition? Remember, malnutrition refers to deficiencies, excesses, or imbalances in a person's intake of energy and nutrients. On one end, it can mean undernutrition, underweight, and wasting, whereas on the other end, it can mean overweight, obesity, nutrition-related diseases. Malnourishment does not just mean not enough nourishment. It means bad nourishment, incorrect nourishment. It can be, on either end of the spectrum. And most Americans just don't realize that they're malnourished, especially in cases when they're eating maybe too much. But just know it's really essential to make sure that you're getting those recommended certain areas of nutrient intake, because it still can lead to malnutrition to eat too much of the wrong foods. So how do we combat this thing called sugar? Well, one of the main goals for CDC's Healthy People 2020 is to reduce added sugar intake in our foods. What public health initiatives are in place? A proposed sugar tax of sugar-containing beverages, supersized drink bans, which occurred in New York City, or school lunch menu revisions, which happen nationwide. Combating sugar is key in improving not only oral health, but also overall health, and making your smile happy. So, why should this matter for people who are learning about teeth? Hey, you know what they say. Don't look a gift horse in the mouth, if you've heard that one before. So nutrition and oral health. Nutrition and oral health have this unique bidirectional relationship. Deficiencies in nutrition are actually visible in the oral cavity. And medical professionals can even delineate which deficiency a person might have by looking in their mouth. So choosing healthful foods not only keeps the mouth clean and healthy, but it helps to keep the body healthy, which in turn keeps your mouth healthy. So let's just rest and digest for a moment. The mouth is the first step in the process of digestion. Remember, food mixes with saliva, beginning our digestive process. Because these foods, typically carbohydrates, are broken down into simple sugars, fructose, glucose, maltose, and lactose, starting with saliva. This process occurs via an enzyme called salivary amylase. Remember that about 5.5 pH is that critical threshold at which dental tissues dissolve, which in turn can cause cavities. This acidic process may demineralize the teeth. However, it is an essential part of our digestive process, so it's not something that we ever want to reverse. It's just something that we need to combat and keep our teeth really healthy. So when are these nutritional deficiencies visible in the oral cavity? What do you mean you can see it? Well, first there's diet-based malnutrition, eating too much of the wrong foods. But there's also disease-based malnutrition. So just know, alcoholism, eating disorders, diabetes, cancers, GI disorders, endocrine disorders, those all can cause the same deficiencies that are seen within the oral cavity. They're not to be ignored. What happens in the mouth exactly? Well, halitosis, or bad breath, is one of the key indicators of malnutrition. Xerostomia, dry mouth, dental caries, tooth decay, which obviously happens over time, periodontal disease, disease of the gums, including, but not limited to, inflammatory conditions, gingival overgrowth, even recession of gums, or ulcers. Ulcers are quite known for possibly a vitamin C deficiency. Infections, fungal, bacterial, viral, or problems with development, including enamel problems or bone malformation. And lastly, pain. So if you just want to take a pause at this slide, it's a little too much to go into detail, but effects of specific nutritional deficiencies on development of the oral structures or on the actual oral cavity the grown oral cavity. And you can just see that each certain vitamin or macronutrient or, deficiency causes certain specific symptoms and signs that can be present in the oral cavity. The key is finding the balance, practicing moderation, and really practicing moderation, maintaining mindfulness about what you're eating, choosing a well-rounded variety of foods, and avoiding frequent snacking. Lastly, eliminating those refined sugars and drinking water, preferably tap, especially if it has fluoride in it. Some risk factors for poor nutrition: systemic health conditions, limited access to fresh foods, poverty, lack of education, lack of mobility or dexterity, difficulty eating or swallowing, unhealthy environments, or alcohol and drug use. And just a quick note, food deserts. Even when the knowledge of proper nutrition is available, the resources may not be available in a given environment for people and families to choose the proper foods. Urban neighborhoods or rural towns have limited access to affordable fresh foods, and in 2016, 12.3% of U.S. households were considered food insecure. Children and adults living in poverty are really affected by food deserts, even more disproportionately. And if you'd like to look at your own or at the U.S. Atlas map, it's available on the USDA for where certified or designated kind of food desert areas are. And it's important to look that up and know about your neighborhood and know about the people you are serving to know if this might be a problem that they face day to day. Lastly, what are some oral health related risk factors for poor nutrition? This means problems with the mouth that may not allow one to achieve adequate nutrition. Tooth pain, inadequate dentition, not enough teeth for good biting or eating. Ill-fitting dentures. If dentures don't work, it's very difficult to consume proper foods. Tobacco, alcohol, and or drug use. Dry mouth, xerostomia, difficulty swallowing or chewing. These are all issues that affect nutrition. Keeping your mouth healthy, in turn, keeps your body healthy. Remember, you are what you eat. Thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com. And see you next time for Nutrition Part 2. Thank you.